Well, hello, everyone. Thank you for joining our annual Alzheimer's Association Washington State Chapter Public Policy Town Hall. We are having people flow in from the waiting room, so we're going to give it just a moment and then go ahead and get us started. So hang tight for just about a minute, and we will get ourselves going here shortly. Thank you all for being here. Really appreciate it. All right. So I will get us kicked off here. For those of you who don't know me, my name is Brad Forbes, and I am the Director of Public Policy for the Washington State chapter of the Alzheimer's Association. And I have Nicholas Hart here with me, and I'll give him a chance to introduce himself momentarily. And I really appreciate all of you being here today for an update on the work that we've been doing with our elected officials at both the federal and state level. You can see on the slide here, we're going to start with a federal affairs update momentarily. But we'll move on then to state affairs, and after that, we'll make sure there's time at the end for you to have any of your questions answered. And so on that note, just a couple of quick housekeeping items before we get going and talk about some of the great work we're doing. If you're having trouble hearing me or seeing me, please feel free to let us know through the chat function at the bottom of your Zoom screen. The issue may well be on our end, and if there is a problem on our end, we would love to know about it so that we can rectify it. And then there's also at the bottom of your screen a Q&A function for question and answers. And so if you have any questions about the material that we are presenting, feel free to go ahead and use that Q&A function, and we will get to all of your questions at the end. So just a reminder, we're saving time for questions at the end, and we'll take them all at that point. And so with that, I would like to hand it over to my colleague, Nick, to introduce himself and get us kicked off with a Association Federal Affairs update. Go ahead, Nick.
Thank you, Brad. I appreciate the introduction. My name is Nicholas Hart, everybody, and I'm a public policy manager with the Alzheimer's Association's Washington State and North Idaho chapter, here to give you a little bit of an update on advocacy and what we've been able to get done in Congress. So next slide, please. Okay, so first and foremost, I want to highlight that this really was a unique year for progress towards our cause. Years ago, Congress passed a crucial national plan to identify Alzheimer's as a public health crisis and begin working to address it, which I'll speak to more here in a moment. This plan, the National Alzheimer's Project Act, has led to major advancements in research, clinical and long-term care, and public awareness, but was set to expire in 2025. Truly, it was among the very most important priorities that we have had in Congress, and we're very proud to say its renewal was signed by President Biden on October 1st, after years of building strong bipartisan support for it through your advocacy. I'm very proud to say all of Washington's members were supportive of that. Next slide, please. So here's a little bit more about those top achievements in Congress. As I mentioned before, NAPA was signed into law this year, renewing our nation's comprehensive plan to address Alzheimer's. With it, the Alzheimer's Accountability and Investment Act was signed into law, That's a companion bill to NAPA, which continues to require scientists and members of Congress to stay in regular communication about research funding and developments. Bold passed the Senate unanimously, and also that the Senate passage happened recently. It had passed the House earlier, and is now headed to the president's desk. That fosters collaboration between federal, local, and tribal health departments. I'll speak to that a little bit later. And research funding, as you likely know, is always a top priority in what we do. For now, please know that the National Institutes of Health are where congressional research funding for Alzheimer's is housed. Every year, the scientists over at the NIH submit a budget request detailing the progress that they hope to make in new research advancements and how much that will cost. So last year, we were able to allocate them $226 million, which is most of what they asked for. So next slide, please. So what does all this mean? You know, we've had some important congressional gains in support for those affected by Alzheimer's and other forms of dementia this year. But I really feel like this is the central question on all of our minds. You know, what does this mean for us and our families? What does it mean for ours or loved ones' journey with Alzheimer's? What does it mean for doctors' visits, for caregivers and family? And I want to give you just one example of how your work with an Alzheimer's congressional team, working with us and these members of Congress, phone calls, emails, social media posts, meetings with staff, all of that. I want you to see how those things you do move the congressional needle in the direction of those we serve. And so I'll give you just one example here on the next slide of that. I'm sure most, if not all of you know that the process of diagnosing Alzheimer's itself has come a long way. I'm sure you remember in the past what that was like. It saddens me to say that we experienced that in my own family. We, in the past, have had all sorts of, I'll say, indirect ways to try to tell if somebody had dementia. There would likely be a physical exam, maybe some cognitive testing, then maybe a neurological exam before you crossed your fingers and hoped for a diagnosis that you knew you'd been experiencing personally. And thanks in part to Congress heeding the scientists' calls at the NIH to fund the achievement of these specific research benchmarks, doctors can now rely on a combination of diagnostic tools combined with a person's medical history. Simply put, the diagnosis process has gotten a lot better because of this research. What's more, these diagnostic tools now include PET imaging, so we can actually see an image of Alzheimer's in the brain rather than essentially trying to indirectly measure its growth, if you will. And now we're talking about even using fluid biomarkers in the future, which you're likely already familiar with, but on the next slide, I'll get a little bit more into specifics about. Could we go to the next slide, please? It's very exciting that we've now crossed that research and treatment threshold with Alzheimer's as well. And one of the emerging fields I'm most excited about is that of blood biomarkers. So you know that we finally have treatments which can actually slow the progression of Alzheimer's in the brain if applied in the early stages. We would not have these treatments were it not for the combined efforts of the Alzheimer's Association and Congress in research funding. It's quite possible in the future that individuals with Alzheimer's might take these treatments and use fluid biomarkers throughout to track how well they're working and whether there are side effects in real time. This could, for example, look like the finger prick device that people use to detect glucose levels in those with diabetes. But imagine a similar biomarker which could use blood-based tests to maybe measure the level of amyloid and tau in a person with Alzheimer's. Many of us at risk dream of a treatment that we could administer at home and with a way to monitor those levels as we might manage the progression of the disease and our treatment more effective and comfortably. And our work in Congress is helping to make that possible. Next slide, please. What I'm really getting at here is that all of this work with Congress and maintaining progress on research is deeply personal for all of us. And when we all lean into the cause together, it can really be surprising who you learn has been right there with you dealing with Alzheimer's as well. Last spring, a group of Alzheimer's advocates traveled to DC to meet in person with our members of Congress and talk about crucial legislation. And during that meeting with Senator Maria Cantwell, she actually left the Senate floor early to join our meeting, met with us for an extra 45 minutes after what we had planned. She had a lot to say about how dementia had affected her family in the past year. She said she was really, really happy to meet with us because it turns out that her mother had been progressing for some time, and her own family hadn't been spared the kind of complex healthcare maze that we all have to navigate for a loved one with Alzheimer's. So she had a person in her family dealing with it as well. Every time we asked her to support something, her response really was emotional. You know, how can I help? How can I help? What can I do? Saying to her staff member, get me on that bill. I want on that bill. She was very direct. It was such a relatable conversation that there were points where you could have forgotten you were talking to a US senator. Of course, we were reminded later when she became a lead sponsor of the ADAPT Act, one of our key legislations, and a co sponsor of NAPA and AAIA as they passed. This is a really good example of how there's no more effective way to lobby in this cause than to just share how it affects you and how these bills would help people like you. Sharing your own personal story is so much more important than knowing the minute details of a bill, because after all, Brad and I can follow up about details with staff for you. And I encourage you all to think about doing so and getting involved in advocacy. Only we can tell others who don't know what we've been through. And on the next slide, I think is another really good example of what can happen when you keep sharing your story. So NAPA and AAIA came up for renewal in January, about to expire. Patricia Keenholz, an Alzheimer's congressional team member from Spokane, actually penned an op-ed, which was pitched to the Spokesman Review, calling on Congresswoman Kathy McMorris Rodgers to co-sponsor and pass the bill. Well, Kathy was actually the chair of the first committee that this bill needed to pass to even start the process. And Patricia's advocacy here really helped to catalyze that initial process in committee. And as I mentioned before, it was just tremendously important to pass this bill for those affected across the country. This effort in particular started right here in Washington. So I love this example of what a simple sharing of our story can grow into when it comes to making a positive impact, and in my view, protecting others in the future from some of the hardships that we face today. So next slide, please. We've made historic progress in moving our legislative priorities through Congress, and you've gotten a glimpse of how we do it through sharing our stories and the impact that it makes on the ground, so to speak, for the people living with the disease. But our work is by no means finished, and this is more or less a broad description of the kinds of things that we're focused on moving forward in Congress at this point, the areas that we feel people need help. Now, a broader list of bills that we support, there are dozens, can be found on our website. But every year we identify 3 or 4 top priorities to really call attention to. And next, I want to get into specifics about those priorities. So next slide, please. So this year we'll be looking to again answer those NIH scientists' requests for research funding. Like I mentioned before, their request this year is an additional $318 million to help ensure that the new progress we're seeing in research, treatment, and prevention doesn't slow down at all for the people that we serve. And next slide, please. And the other funding increase that we were pursuing this year had to do with the Building Our Largest Dementia Infrastructure, or BOLD Infrastructure for Alzheimer's Act. It instructs the CDC to build a better public health infrastructure through state, tribal, and local health departments, federal health department kind of collaboration across the board between those. As I mentioned earlier, BOLD passed the Senate last month with Senator Marianne Cantwell's strong support. It also passed the US House, and we're very happy to say that it's on its way to President Biden's desk, and we're expecting a signature in the next 2 weeks. Next slide, please. And as we enter a new era of Alzheimer's treatment, we know that access to a timely and accurate diagnosis is even more critical. We know that only half of those living with Alzheimer's disease are diagnosed, and of those, only half are even aware of that diagnosis. So that initial diagnosis is often made by primary care providers, but because they're not dementia specialists, most report that they feel a little bit unprepared to provide care for those that they might diagnose. So state-based Project ECHO programs have shown a lot of success the Alzheimer's Association helped pilot these. They're the first of their kind. They're programs that have shown they can address those knowledge gaps for those providers. It better reaches rural and medically underserved communities where primary care physicians are especially strained because it's a telementoring program for professional care providers. And so with the ADAPT Act, we're really looking to roll something like this out nationwide. ECHO really emphasizes high quality person-centered care in community-based settings. So the ADAPT Act is a huge priority of ours, and the one that I'll close on. In the next slide here, I would, of course, invite you to get involved. We're truly changing the landscape of support and treatment for the better in really significant ways. And we really encourage you to talk to us about what you can do. We have teams that you can get involved with regularly. If you want to, just every once in a while, lend some help to our cause, please do get in touch with us and we can help you do that as well. So without further ado, I'll go ahead and transition it over to Brad, and he can tell you a little bit more about these efforts at the state level.
Well, great. Thank you so much, Nick. And I see we do have a few questions in the Q&A function. So thank you for those of you who are asking those questions, and we'll certainly get to those here in just a little bit, as I mentioned before. But as Nick mentioned, I'd like to switch to talking about some of the work that is being done around Alzheimer's and other dementia at the state level, both within our state government agencies, as well as some asks we're going to be making of the legislature in this upcoming session. So if I could get the next slide, please. So I'd like to begin the discussion of state affairs by talking about some of the work being done within state agencies. So Washington has an official dementia work group, and this is called the Dementia Action Collaborative, or what's more commonly referred to as the DAC. And the DAC has been around for more than 10 years and is currently established in statute. It's made up of a number of subject matter experts on dementia, as well as representatives from various state government agencies that interact with people with dementia and serve people with dementia, including the Department of Social and Health Services, the Department of Health, and the Healthcare Authority, which is our state Medicaid agency. The group is co-chaired by myself at the Alzheimer's Association, and B. Rector with the Aging and Long-Term Support Administration, which is the government agency that houses the DAC. And really the overarching work of the DAC, the crux of their work is to develop and implement recommendations for our state Alzheimer's plan. The most recent iteration of this plan was updated in 2023 with dozens of recommendations that the state, recommendations for actions the state can take to improve outcomes for people living with dementia. And these recommendations include issues from primary care to the importance of early detection of Alzheimer's and dementia, all the way to promoting legal planning and estate planning for families. And so I'll be sending you a follow-up email after this town hall that will include a number of resources, including a recording of this presentation, but also I'll be sure to include a copy of the state Alzheimer's plan and a link to the DAC website if you're interested in learning a little bit more about the work that the group is doing. But lastly, what I want to focus on today with the discussion around the DAC is around the fact that the DAC also submits recommendations to the legislature asking for funding and policy changes that will help to advance the implementation of our state Alzheimer's plan, providing better services to people and support for families. And so now I'd like to move to the next slide and talk a little bit about what these legislative priorities are that we're going to be taking to the legislature. So to start, I'm going to list several programs with funding requests, but I want to sort of level set and let folks know that the way that the budget works in the state legislature is it is excuse me, it is budgeted on a biennial or 2 year process. And so what's going to happen when the legislature meets in January is that they're going to author and pass a 2 year budget to fund all of our state agencies and broader state government for the next 2 years. And so when I talk about the amount of money that is being requested, just a reminder that this is on a biennial basis for 2 years. I want to start by talking about the Dementia Resource Catalyst Program. And this request will be for $750,000 for the biennium for the actual operation of the program, and 150,000 for the biennium for program evaluation. And I'll get into what that means in a moment. But just for information, this is a program that is run through the area agencies on aging, which is a program that delivers services and resources to people living with dementia who live in their own home. And the Dementia Resource Catalyst Program, allows people to live at home longer, which honors their personal wishes for independence, and also prevents costly long-term care placements by allowing people to live in their own home for longer. There are currently 3 area agency on aging regions that have this program. There is the the Northwest region based in Bellingham, the Northeastern region based in Spokane, and a third site on the Olympic Peninsula. The Bellingham and Spokane-based programs are funded on an ongoing basis. So that funding will continue. And so our ask of the legislature this year is for the 750,000 for the biennium to sustain the rural Olympic Peninsula-based program, as well as for the $150,000 for program evaluation, because this program started a few years ago in 2021 as a pilot, and DSHS needs to do a report about some of the great successes they're seeing to sustain this work going forward. Next up, you'll see here we are asking for a little more than $557,000 for the biennium to sustain the growth of what's called Project Echo Dementia. This program was developed through the DAC, and it provides remote, as in over Zoom, education to healthcare providers who want to learn more about interacting with and serving people with dementia. And since this program started in 2020, over 200 clinicians have received dementia education through Project Echo Dementia, which is totaling over 1,600 hours of training. And the demand for this program has increased year over year. And so to continue to sustain the growth of this program, we are requesting $557,000 to ensure that it can continue. Next slide, please. Thank you. Lastly, I want to highlight the legal planning program. This request will be for $243,250, a pretty specific amount for the biennium for this important program. It is operated by the Washington Pro Bono Council, excuse me, and is a legal program that is free to anyone who wants to participate. It promotes early legal planning, which helps in the long run to uphold an individual's wishes. It's a program that helps to identify surrogate decision makers for when that is necessary, and also ultimately reduces the need for people to go under full guardianship, which not only helps to protect the individual, but saves the state and families a lot of resources. So once again, we are asking for $243,250 to ensure that that important program can continue into the future. And if we go to the next slide. Thank you. So the three asks that I just ran through are the priorities, the recommendations from the Dementia Action Collaborative. And so now I would like to go through a couple of other priorities that we have that are specific to the Alzheimer's Association and are asks that we as an organization will be making of the legislature this next coming session. So if you could go on to the next slide. Thank you. Um, last session, the legislature funded our state's first ever full-time employee program dedicated to specifically to dementia, and this is within our state's Department of Health. Um, Having staff in our public health agency who are solely focused on dementia is important to ensure a coordinated response from the state to the age wave and increasing number of Washingtonians living with dementia. The person who runs this program is already hard at work to develop programs and coordinate programming around dementia within the State Department of Health. And so we are asking the legislature to continue this program by providing $336,000 of funding for the biennium to make sure that that this work can continue. The next slide, please. Thank you. Lastly, the final priority I want to leave you with is a bill around biomarker testing. This legislation that we're currently working on would require carriers to cover biomarker testing. As Nick mentioned earlier, biomarkers are measurable biological changes that can show if a disease is present, and in some cases can show if a person is at risk for developing a disease. And with research on a blood biomarker for Alzheimer's looking promising, we need to ensure that people will have access to this biomarker testing right when it comes to the market. And so this legislation will ensure that Washingtonians can access this necessary testing by requiring the coverage of these tests, which reduces the time it takes for a person to receive a diagnosis and then further enables their own access to not only disease modifying treatments, but also gets people involved in care planning as early as possible, improving outcomes. And without taking without taking action on this legislation, dementia diagnoses can take up to 2 years longer, which increases not only long-term costs, but stress to the individual and their family and care partners. So if you go to the next slide. Um, so if you're looking for a way to help out with the state affairs, one thing you can do is to save this date. Every year we host an advocacy day in Olympia, and this year is no different. This year it will be Tuesday, February 4th. And in the follow-up email that you get to this, I'm going to include a registration link for that day. But for those of you who maybe haven't participated in Advocacy Day previously, this is also sort of commonly known as our day at the Capitol, where we will all meet at a location near the Capitol in the morning and then spend the day going to the Capitol and meeting with legislators who represent you in Olympia and talking about why all of these state level priorities are so important and how they'll affect people's families. So save that date. If you go to the next slide. Thank you. And so, before we move on to Q&A, I do want to make sure that you are all aware of an important resource offered by the Alzheimer's Association should you need any help at all. If you need help, the first thing to remember is that you're not alone. You're always welcome to utilize our national helpline. And that number, you see it on the screen there, is 1-800-272-3900. This 24/7 number is staffed by clinical social workers who can answer questions, really any question that you have relating to dementia, including if you see a family member exhibiting certain behaviors, asking, is that potentially a sign of Alzheimer's? Or, if you could say my mother in Indiana needs help finding an assisted living facility. How do I get started with that process? And anything in between. So please know that we have operators standing by, and don't hesitate to reach out if you have any questions at all relating to dementia. If you go to the next slide. Thank you. And as this slide says, thank you. I want to take a moment to thank all of you for being here today, and for your interest and passion and advocacy when it comes to fighting Alzheimer's disease and all of the dementia. And so with that, I would like to take a second here to transition to questions. And I see that we have a number of them here. And I will be the one to sort of MC this a little bit. Nick and I will take your questions, at least as many as we have time for. And then if I don't have the specific answer, we've got all of your contact information, and so we'll be sure to get that to you if it's not something we can just answer on the fly. So with that, I'm gonna sort of go down the list here. So we'll start. So there's a question from Jerry Boggs that says, "I thought the new blood test was definitive." So I would love to hand over to Nick to talk a little bit about where we are with the biomarker testing.
Thank you. Thank you, Jerry, for that question. So to provide some more specifics on that, blood biomarkers are currently being used and increasingly being used in the diagnostic process for Alzheimer's. Those tests are definitive. So I think those are the tests that you're talking about. We're already at that stage where these blood biomarkers are being used for the purpose of diagnosis. And what we look forward to in the future, we're in the very, very early stages of this, but we hope to be able to use biomarkers to maybe monitor disease progression, I should say, to reliably monitor disease progression, as well as the efficacy of treatments going forward. That's certainly where we hope blood biomarkers move to. So those tests are, they will have to be definitive in how they're used. And I'll say the first FDA approved blood test was passed in 2020. So we're still in the very early stages of this, but to answer your question, they are used definitively in the diagnosis process, and we hope to use them definitively in the disease management process going forward.
Great, thank you so much, Nick. Going back to the question here. And this one I'll actually keep you on the line here, Nick, which is a question from Michael O'Connell, which is, how much funding is going to researching the root causes of Alzheimer's as opposed to the end products like amyloid plaque removal?
That's also a good question. I don't know off the top of my head how the divvying up of our funding goes between, I would say, research towards prevention and research towards treatment of people who already have the disease. I can follow up with you directly. That's a number that I can find, Michael, for sure. But I will tell you that the Alzheimer's Association is into the hundreds of millions in what we invest, both on the prevention as well as the treatment, and once people already have it. I would say we're just as focused on one as the other, because what we estimate is that if the proper types of prevention methods and early diagnosis are adopted en masse in our country, we could prevent or delay as many as 40% of cases in Alzheimer's disease going forward. So that's a number that we certainly hope to strive for. But I can follow up with you with an exact number in terms of what we're funding for prevention versus what we're funding for treatment in people who already have a diagnosis.
Great. Yeah, thank you, Nick. And uh, I see Michael O'Connell asked that question, and you had a couple others about how you get connected to these services. So, Michael, I would be happy to reach out to you, and I'm glad to see you here. It's good to hear from you. Um, okay, it's just gonna kind of go down the list here. Um, Nick, can you remind us what is the congressional bill that is waiting on the president's signature, expected to be signed in a few weeks? I know you mentioned that.
Yeah, I like the wording of this too, Joey POTUS. Yeah, thank you for that question. So that is actually the Bold Infrastructure for Alzheimer's Act, which is all about the CDC. It basically instructs the CDC to be a part of this National Alzheimer's Plan in using their resources to really collaborate from the federal level between state and tribal and local health departments. So it's really trying to make sure that everybody who is involved in this process, down to King County's own dementia specialists, can be on some level coordinating with each other, so they're at the very least aware of where other supports exist in the federal, state, and local kind of apparatus, if you will. So that's the Bold Infrastructure for Alzheimer's Act that is heading to his desk. And I mean, unless something really crazy that I can't foresee happens, he will sign it. So, yeah.
Yeah, thank you. And so I will take this next one from Aruna Bhuta, which is around what can be done with primary care providers practice like multi-care, Providence, et cetera, so doctors can participate in ECHO. I will certainly be sure to reach out to you after this and connect you with the people who run Project ECHO so that you can have that information on how to appropriately get providers into that program. Um, and then we've got one here too, another one that I will take from Mark Hawley, which is that the state budget is currently, quote, underwater. Do you anticipate trouble getting additional funding for the Dementia Resource Catalyst and ECHO? So just so that folks know, what Mark is talking about here is that the state revenues that fund the operations of the state government have declined in the most recent estimates the most recent revenue forecast. And so, I think that it's going to be a hard fight for funding for really any program, regardless of the issue that you work on this upcoming session. But that we do have very strong stories to tell around the successes of ECHO helping with provider education, as well as getting getting to be able to be sure we continue the Dementia Resource Catalyst program, which is serving folks very well and at capacity in those three regions. I want to also reiterate that I see we have a second question here about connecting to the legal planning folks, and I will certainly do that afterwards. And then there's a question from Peter Newbold. Peter, good to see you. And the question is, are any of these asks included in the governor's budget? That is a very good question. And so for those of you who don't know, every year before the legislative session, the governor releases what is called the governor's budget, which is the sort of starting marker for the programs and agencies that that the governor believes should be funded. And so we're waiting on the governor's budget to come out. So I don't know yet, but knocking on wood, hopefully these programs will be the governor's office has a seat in the Dementia Action Collaborative, and so their office is well apprised of all that work, and not only that, but the importance and success of those programs. So more to come on that. Um, and then we have, let's see, we've got a couple questions that are kind of already been asked here. Um, so I'm going to combine a couple of these questions here, Nick, for you, which is who would do the blood biomarker testing? Do you know, is that like a primary care physician? Would you have to go to a specialist?
It would be applied in clinics. So yeah, it would be a specialist. But yeah, when you say who does the biomarker testing, I did see another question about insurance coverage with that too. Should I speak to that as well?
Yeah, sure, please.
Um, so I am not. We're very early in this, and I am not aware of a private insurance that covers blood biomarkers. All of this is happening in real time, and I really hope that I'm wrong about that. It's very hard for me to predict that that won't happen in the future. Um, our hope is certainly that insurance covers this testing. Um, in our view, it's not hard to see, even from an insurance company's standpoint, how costs are saved tremendously when somebody has an early diagnosis, time to plan, less avoidable hospitalizations, and that kind of thing. So, private insurance is not required to cover this, and it's not a common practice. I hope for that to change. Um, when it comes to where Medicare might be able to step in, programs like that, we're absolutely absolutely exploring that as an option. We want people to have access to this, no matter how affordable it is for them. So that this is very much a front that we're pushing on. But that biomarker testing will be done clinically, and so there are those costs affected with it. And it's in the broader maw of fighting for people's access and better coverage that we're very much seeped in right now.
Great. Thank you so much, Nick.
Mhm.
Um, and we have a question from an anonymous attendee, which is where are people living with dementia in this advocacy work, and are there pathways for them to participate? So the answer is yes. The first thing that I want to mention is going back to my conversation about the DAC. I am very proud that of the limited number of seats on the Dementia Action Collaborative, one of them is a full-time permanent seat for a person living with the disease to share their perspectives and experiences on how the state can do better by people living with Alzheimer's disease. And then in terms of the association advocacy, yes, when I do the follow-up email, you will have Nick and my contact information. There is always a need for people living with dementia on our Alzheimer's congressional teams, meeting with our members of Congress and U.S. senators, as well as on association-based state advocacy as well. So please, once you get your follow-up email, go ahead and reach out to us, and I would love to have that conversation and hopefully get as many folks involved in our advocacy as possible. And then let's see here. We've got time for just about one more, and I know that we won't get to all of these, but as I mentioned before, if you entered a question, it comes up with your name, so we'll be sure to um, reach out to you, including so we'll do two more questions. One of them is, can we get a copy of the slides? And the answer to that is yes. And then let's see. So give me just a second here. So there's is one here from Lupita Gutierrez Parker. Does the Washington State chapter have a list of where people can go to get blood biomarker tests? So I will take that one and say that we don't have that at this moment. But as the tests become available and are being administered in the community, Lupita, I would love to stay in touch with you on that because making sure that folks actually know where to go to access emerging treatments is very important to the association, and so you will certainly all be hearing more from us once we have that information. So
Could
yeah,
I could I add?
please,
Could I just add to that, Brad?
yeah.
Um, I it Lupita, you raise a really good point. And about these blood biomarker tests, who administers them? It really is a question of which people who have the ability to diagnose Alzheimer's right now are incorporating blood biomarkers into that process. So this is definitely something that we're in the early stages of the rollout of, and we will absolutely have a pulse on. But it's yeah, Brad, I think you put it perfectly. It's all happening in real time, and it. I just wanted to add that it really is kind of a question of which providers have incorporated this, who are thinking about it. There are some, I'm sure, who aren't even aware of it, but we're definitely trying to proliferate the testing.
Great, thank you, thank
Yeah.
you so much. Um, So with that, I think that I will be sure to get back to the number of folks whose questions we weren't quite able to get to, and make sure that you get those answered. But I do want to take a step back and thank you all one more time for your willingness to be here and your interest in the Alzheimer's Association. And so you can all look for an email from me, Brad Forbes, closer to the end of the week, following up on this, which will include access to the recording as well as a copy of the slides and all sorts of information about the work that we are doing and that the state is doing around Alzheimer's and all other dementia. So with that, thank you again. And I hope you all have a wonderful remainder of your Monday. Thank you.